Started. Welcome everyone and happy new year. We are in 2021. We are hoping for a good year this year. We've entered with several challenges, but um, there is hope and the sky is looking brighter every day. We welcome each of you and ask you to type your county into the chat. This just helps us to know who's represented today in our COVID session. And again, we want to welcome you. We'd like for you to keep your microphone on mute. For now, we will have opportunity for Q&A after our guest presenter is done with sharing information. We like for this to be a really open, dialogue and conversation about the issues revolving around the topic that we will be focusing on this morning. And you can turn your camera on if you desire. It's not a huge crowd, so that can be helpful. Right. And with that, let me introduce our guest speaker. We're going to be talking about transportation in the midst of COVID, or I like to always call it mobility and access. In the midst of COVID, how are we accessing our communities? How are we accessing the things that we need? How do we get around? How do we go from point A to point B? And I'm excited to introduce Carrie Butler. Carrie and I go back a long way. She may not even know that I've retired and since retirement come back to work at the Traeger Institute. So I'm so excited to introduce her this morning. She is the new Executive Director for TARC, the Transit Authority of River City in Louisville, Kentucky. Her role includes overseeing the agency's $80 million operating budget and over 600 employees, providing nearly 14,000 trips per day over 20 routes throughout the KIPTA region. Since 2014, Ms. Butler served as General Manager of LexTran in Lexington, Kentucky. She is President of the Kentucky Clean Fuels Coalition and has previously served on the Planning Commission and Lexington Senior Services Commission. She has a master's degree in urban and regional planning for Florida State University and a bachelor's degree in economics from Bellarmine University. She developed her passion for public transportation during her fellowship from the Florida Department of Transportation, where she worked for Miami-Dade Transit and Star Metro in Tallahassee. Previously at TARC in 2010, she managed the Department of Planning and Scheduling. While at Trans Systems, her project focus was on intelligent transportation systems, planning along with a range of transit and urban design plans for transit agencies, local, state, and federal projects. She is a highly motivated, energetic transit executive with 20 years experience in the field of transportation and urban planning. Her broad base in the industry ranges from executive leadership and management, service and long-term regional planning, and a current focus on sustainable business practices and high return on investment innovations. I'm welcoming you, Carrie. You take it over and just share with us how we can survive in this pandemic.
Thank you, and I always feel a little, I don't know, kind of embarrassed when people read your bio and you're like, oh my gosh, but it reminded me of how we got to work together back at the Area Agency on Aging at KIPTA and a travel management coordination center and technology projects, and it's interesting to think back sort of where we were and kind of where we are now, and just where progress gets made and where things sort of get jammed up in the just day to day of trying to get things done. So I am going to attempt to share my screen and just go through some slides, and I will try to get through this fairly quickly so we have time for questions and can have some good discussion. Does everybody perfect? Oh my gosh, it's all, I always feel like it's such a miracle when I'm able to get the slides up. So I start this slide just kind of an overview of TARC and then a little bit on our response to COVID. And I start with this slide of Union Station. This is where TARC is headquartered currently at 10th and Broadway. And first of all, I love the building, but I also like to just remind folks of sort of the permanence of transportation and kind of to Barbara's point, mobility and access and people moving around, getting where they need to go on any given day. This slide from the early 1900s, if you look down at the left, shows streetcars. It shows the cab stand just to the right of the building. And it's so interesting to me that we've been doing these things for years and just kind of trying to innovate and improve over time. TARC's mission statement to explore and implement transportation opportunities that enhance the social, economic, and environmental well-being of the greater Louisville community. This is one of our recent operator classes. They graduated and went into revenue service. They violated social distancing for just a minute to pose for the picture because we always want to celebrate all their training and hard work to get to that place where they get their badge and they're able to go out on the street and provide that service. Our services, we operate really three main types of public transportation service. We have fixed route, paratransit, and then a rideshare and van pool program. So our fixed route is local and a handful of express routes. We have a rapid transit line on Dixie Highway, some circulator routes, operate 7 days a week, nearly 24 hours a day on some routes. And that's really our core service is fixed route. Those are the buses you see on the street every day. Sometimes you probably get stuck behind one and get irritated because it's stopping too much. But I always think about the people who are using that service, getting on and off the bus to get where they need to go. Our second is our Americans with Disabilities paratransit service. Sometimes you'll hear that complimentary paratransit service. That just means that it is service that within 3/4 of a mile, we provide a door-to-door shared ride service for people who by nature of their disability can't use the fixed route service. That's operated through a contractor. Our current contractor is MV Transportation, and TARC has traditionally operated that through a contract for a variety of reasons, cost, ease of implementation. Our third piece is a regional rideshare and van pool program called Every Commute Counts. This is a service that's very popular, especially for folks who live outside of Jefferson County or maybe live in Jefferson County but commute to Frankfort. This is a sort of a group shared ride service where you and a group of coworkers can share the cost of commuting in a van or a SUV. So that's a kind of a regional service that we provide. Reasons to ride, parking cost can be a big hassle. There's some increased independence, especially, the Traeger Institute thinking about older adults and how they get around. I think that increased independence that you can get from public transit is important too. There can be some financial savings as well with, the lower cost. It's much lower cost of owning a car to riding transit. And then some sustainability reasons, decreasing your carbon footprint. It's less stressful than driving. And, you can TikTok, you can do all your social media safely while you are riding the bus. Our customers really are everyone in our community. And we really think of this in terms of the broadest customer base that we have. We are a taxpayer funded organization funded through Jefferson County occupational license fee, and feel that's important for us to remember that we have customers and then sometimes we have riders. So we may have people that are paying for the service, their employers in the community. They may not be using the service every day as a rider, but they really are customers because maybe they have employees that are riding the service. They have students, people they work with or know. And so we really see a broad brush throughout the community of people who are riding or are our customers. Sustainability initiatives. I know I have a ton of information on this slide, and just wanted to point out a few things, and specifically because this is where I see a really important overlap between public transportation, mobility, and public health, and sort of the broad encompassment of public health. TARC has worked really hard to improve our air quality emissions and do a lot of things internally to make sure that our business practices are more sustainable and kind of meeting all the goals and objectives of sustainable business practices. So we have a number of fully electric zero emission buses, hybrid buses. We've done some major work to this very, very old building that we're in to make sure that it is energy efficient. So we're, pulling less down on the grid. And then we have some solar projects that are in the design phase and architectural phase right now coming up. So this is one place where I see a good overlap between public health and public transportation, in addition to some of the other public health benefits that you get from being a transit rider. Most transit trips begin and end with walking to and from the bus stop, maybe to and from your house or your workplace. So that sort of physical activity, I think, is also an important overlap between public health and public transportation. Projects and successes. This is kind of leading up to COVID. We did a major upgrade to our fare collection. So when you pay for your fare on board, we have a sort of like a TARC credit card you can load and you use that to pay. We started a comprehensive operations analysis. That's a very detailed look at our routes and our service, our schedules, and got started with that. We did a new website. We had an app that we were looking at. We launched our rapid bus program on Dixie Highway as part of a partnership between Louisville Metro and Kentucky Transportation Cabinet, and then 2020. And like everybody else, things just shifted to COVID. I mean, when I think back to about nearly a year ago, back in early February, it was just like this complete different mindset where even if you wanted to think about something different, it was like you couldn't because there was something new and something happening with COVID, or really how we were going to be able to respond to COVID. So back in spring of 2020, I was trying to look for the exact date, but I couldn't find it back on the COVID Kentucky website. But public transportation was deemed essential, meaning that we were to continue operations as best we could. We never shut down. We certainly had folks that could work from home, continued to work from home. But if you're a bus driver, if you're a mechanic, if you're a customer service rep who's selling fare media, you can't work from home so much. So the vast majority of our workforce here at TARC continued working. We did change some of our service and restructured it to sort of mimic what was going on when we were in a really strict lockdown. And I will caveat this saying, I started here in late September at TARC. I was with Lextran previously. I think there's some folks from Lextran who have joined us. So I don't know that I can speak to the exact specifics of what TARC did back in, March, April, May, but we were in close contact, Lextran, TARC, TANK, the other Kentucky Public Transit Association members, just sort of trying to coordinate what we were doing. But deemed essential, so have really been focusing on essential trips for essential workers. And I think that has maybe been one tiny, maybe bright spot in our response to COVID, is that it has really made it clear to us as an organization how important and the service that we provide to essential workers who are doing essential trips and essential essential service in the community. Initially, our response to COVID, and this goes throughout the industry, was on cleaning the fleet and cleaning the facilities. Back, if anybody can remember, kind of early days of COVID, we weren't sure the difference between the surface transmission and sort of that airborne transmission. So really, we were focused on cleaning, disinfecting, wiping down surfaces. Then, sort of as things progressed, we went into the mandatory mask, both for riders and employees. TARC also put in driver barriers. If you've been on one of our buses, you'll see that there's a kind of a plexiglass shield that sort of keeps the driver separated from somebody who's entering the bus. And we ask passengers to exit through the rear door to sort of minimize the time and the space between a driver and a passenger. And then we're back a couple months, did some social distancing on the buses to keep people spaced out. We sometimes had to add additional service based on the demand. And in my experience writing is people pretty well space themselves out just naturally. I think after 10 months in this pandemic, people are kind of used to just keeping away from other people when you're out in public. We do have a list of all of our responses and sort of what's happened over the course available on our website under the COVID response page. But that's kind of our, been the things that we've done publicly to respond to COVID. And, internally, we've had a lot of change in procedures with testing of, somebody comes to work or hopefully they don't come to work if they're positive, but maybe you have to send somebody home because they're not feeling well. Then you have to do the contact tracing to see who they were around. So that it really has been a shift in our business practices with a tremendous focus on making sure that our employees are safe, keeping our passengers and our riders safe, and just trying to be able to respond to this ongoing pandemic. The other chart, and I have this is our fixed route, so this is our main bus service. Then I have another one for our paratransit ridership. So this shows our weekly fixed route ridership total over the course of COVID, sort of starting with March 9th of 2020. So that's over on probably the far left of your screen. And weekly trips back pre-COVID, just hovering right under 200,000. And you can sort of track along with where it says week 316, March 16th, that's where restaurants were shut down. And that's really when we kind of went into the most kind of strict phase of lockdown in Kentucky. And then you see ridership sort of flattening out, a few peaks here and there, and then kind of leveling off. That red line is the average. So we're at about 45%, sometimes 50% on any given week of our pre-COVID ridership. And this has been a difficult, I'll be honest, this has been a difficult slide, or a very difficult subject for me to talk about, because I'm really proud of the service, and it's always, we want more ridership and we want more people riding, but I've had to kind of tweak my thinking on this and just say, this is actually a good thing, because what this means is that people in our community are just not traveling as much. And I had a conversation with somebody who was kind of plugged into the Kentucky Transportation Cabinet. So this is kind of the highway roadway piece of transportation. And they said that the roadway travel is down, not quite as much as public transit, but they are certainly seeing that in the morning peak, there's just hardly any traffic and hardly anybody traveling. So sort of a similar decline between public transit and highway, maybe a little bit more dramatic for public transit, but certainly in that morning peak, people are just not driving and traveling as much as they would. The other thing that I think that I found that's very interesting about this sort of temporary decline in ridership is this is fairly consistent across the industry. When I talk to my counterparts nationally, everybody has seen, you know, almost to the percentage point, maybe plus or 5 up or down, but is seeing the same drop off in ridership. There's maybe a little bit worse in the bigger cities, but really everybody's seeing this sort of similar decline in ridership. And we hope that once things sort of get back into a normal pace and people feel safe and going back to work, that we'll see that inch back up or even go higher than pre-COVID. This next slide is TARC 3. So this is the paratransit service that we provide, and sort of a similar decrease. It sort of leveled off as we got into the December months, but the same decline, a little bit harsher in the beginning, and but if you can imagine, if you have no other means of transportation and you can't ride fixed route, you know, you're going to have to continue to use this service. But this is your way to get to the grocery, to get to work, to get around. So just a similar trend, but we hope to get back up to, you know, full service here soon enough, or full higher ridership soon enough. That's kind of it for the slides. Like I said, I wanted to leave plenty of time for questions. I appreciate everybody's time this morning. For those folks who work at U of L, we thank you for our longstanding partnership with our Ideas Good as a Pass or FAIR program. And, you know, as I look towards 2021, definitely with hopefulness and some optimism, we know that at least for the next little bit, our attention is going to be on responding to COVID, and we are eagerly awaiting news about the vaccine and the schedule of administering the doses, especially for essential transportation workers. But until then, we're going to keep on keeping on. You know, we have a lot of our policies and procedures in our response, you know, mask wearing, washing hands, social distancing, just really dig in on those messages and, you know, trying to beat that messaging fatigue that I think everybody's feeling about that. But, you know, we have to keep on with all that until we have a different way of doing things. We're going to also continue to message about the safeness of riding, and we have joined in partnership with other transit agencies nationally, sort of a commitment to safety, talking about what we're doing and what our customers can do, sort of as a joint response to making sure that people are safe. You know, they're not traveling when they're sick, they're wearing the mask, they're staying away from people when they can. And then, you know, looking towards our fiscal year 2022, we're on a June-July fiscal budget, so we're already sort of thinking about our next fiscal year budget. That is also in part with changes at the federal landscape. So change in administration, change in transportation secretary coming online. So we are, I should say me personally probably here, cautiously optimistic about the change in administration, getting an infrastructure project done, a focus on public transit. So I'm optimistic, I think, because I almost have to be optimistic at this point. But I think as we look towards that federal landscape, you know, see some maybe some new things, but no specifics right now. So contact information right there, and would love to take some questions from folks if possible. And I will stop sharing my screen. Okay, thanks.
Okay, thanks, Carrie. Justin and I will help to navigate questions that may be placed in the chat. And if you do have questions, please type them out in the chat. And since we are a small group, you can also unmute and share them. So there are a few. Here's one. Do you think the decrease in ridership also has to do with capacity, since the safety precautions include decreased number of people riding?
I think a little bit, but really we saw the biggest drop off when and again, I was working at Lexington in Lexington in March when the first sort of big lockdown quarantine happened, and that's really when we saw things drop off. That was before there were some specific capacity limits on buses. So I really think it had to do more with people just working from home, kids not going to school, just that immediate shift to kind of more of a virtual world is really where we saw it. But probably a little bit, but it was really just more people just weren't going anywhere. It was very dramatic. It was very dramatic at first. Um,
What are your protocols for keeping vehicles clean?
the uh, high touch surfaces has been where we focus. So handlebars, railings where people are getting on and off the bus, using that handlebar to get down. And then we have, and I am not like an engineer, so I really can't speak to the specifics of how this works, but there are sort of some, I think they're like electrostatic sprayers that spray a mist that we're putting on our bus, and then just stepping up the good old fashioned protocols, sweeping, cleaning on board. As I mentioned, that was a big focus in the beginning of the pandemic. As things moved to kind of more of like it's airborne and we got to wear a mask, the surface cleaning, I don't think we didn't feel like it needed to be done as much as maybe it did in the beginning when we weren't sure that split between surface and airborne transmission. But so the main thing is those high touch areas, stepped up disinfecting throughout our facilities, on our buses as well as in the garage and the office. And that's kind of been the big focus with cleaning protocols.
What are your safety protocols generally, including mask wearing, temp checks, spacing, etc.?
So we have the um, drivers have to wear a mask anytime you're not in. I'm in my office by myself right now, but if you're out in a public space in the building or on property, to wear a mask and wear a mask and maintain that social distance, unless you're eating or in a break room. So we've modeled, we've followed or exceeded the Kentucky Healthy at Work protocols. We have temperature check stations inside, just right as you come inside our building. These are like, they're scanning devices. You kind of put your head up and it takes your temperature and then says normal temperature. So we've had those in place for a while. We have the other challenge that we've had is Union Station. The first floor of Union Station, for those that have been there, is an open, I mean, it's a passenger transit facility. People can come in and wait. They can come in, they can buy tickets and passes for TARC. We have a credit union that is in, unrelated to TARC, but a advanced credit union is in our building. So we have a decent amount of foot traffic. So we've had to have, everybody that comes in that part of the building gets a temperature scan, in addition to our employees where they enter the building that's just employee side. And then we have signs on the floor, kind of that stay 6 feet apart, little stickers that go on the floor that help indicate, where people need to stand. But if anybody else operates a public facility or is trying to mandate this for employees, it was hard at first for people to get used to it. And I think now the challenge is like, my perspective is that people are just tired of it. They just don't want to deal with this anymore. So keeping up that messaging, we're going to try it. We're yesterday talked about doing kind of another campaign to just reemphasize and communicate the same message, but maybe in a little different way so people can be reminded. And but yeah, it's like the duration of this pandemic and having to keep up the messaging and not knowing when it's over. I mean, I said this early on. It's like, look, if I knew this was going to be a 3-month endeavor, okay, we have an end in sight. But for me, that's been one of the hardest things, is we just don't know when this is over. I feel a glimmer of hope with the vaccine. And then I come home and I watch the news and I'm like, okay, forget it. I'm not watching the news anymore. It takes all that positivity away.
Yeah, that is true.
Yeah.
Have you had to decrease or cancel routes?
We did, TARC did in the summer. And I may not get this right since I wasn't here at the time, but we did kind of a modified Saturday schedule. And what I mean by that is we have an amount of service that we operate Monday through Friday. And then on Saturday, we don't operate the exact same schedule and the exact same amount of service. And then on Sunday, it decreases that much more. So we operated basically a Saturday schedule for a number of months, but since then, or after some months, we just went back to more of a regular weekday schedule. And that pretty well also tracks with other transit agencies throughout the country and in, certainly in Kentucky as well. But I see the other question about revenue, and that has certainly been an issue as well with a 40, 50, sometimes 60% decrease in ridership. That means that we have had a similar or concurrent decrease in our fare revenue. So we are, yeah, we're down in our fare revenue, both for fixed route and both for paratransit as well. So that is certainly a concern, and kind of goes back to, kind of trying to see the bright side is when our ridership's down and our revenue's down, that means that people are heeding public health warnings and they're just not traveling as much. So it's, if you're super fiscally minded, there's no positive to that, but just have to kind of take things as you can and just say that that's the impact. It hasn't been for TARC, and I'll knock on wood, we haven't seen as much of the really dramatic decrease in revenue as some of my counterparts across the country have. Um, transit agencies are funded differently across the nation. Some are sales tax, some are driven directly through subsidies from county budgets, or they operate as a department of their county. So other transit agencies have had it much, much worse as far as sales tax revenue going down or their revenue streams being immediately impacted. The other thing is TARC's fare structure is actually fairly balanced. We have a relatively low fare structure in comparison to other transit agencies. So other transit agencies that have a higher fare cost have basically a bigger portion of their revenue budget coming through fares. So when their ridership goes down, that impact to their fare revenue also impacts them. So if you follow any public transportation news, which I'm sure everybody here follows it just like I do, you will see that some of the larger transit agencies, Boston, New York, San Francisco, have been particularly hard hit, and unfortunately are really looking at some structural, major, devastating cuts to their service because they just don't have the money coming in right now. So like I said, I'm optimistic about the federal landscape, and I'm cautiously optimistic about where we are, TARC, and where our budget is. But it's like, the one lesson I learned with 2020 is don't predict anything more than like a week or so, because things will change. So we're okay right now, but call me in 2 weeks and things could be worse or better. I don't know. Maybe 2021 will be different.
Yeah. So here's another question. Let's see, let me scroll up a little bit. What impact do you think COVID-19 will have on the future of public transportation, if any? Is there anything you will take from this that will impact your business model, the way you do things going forward, even once the pandemic has subsided?
Well, I know I sound like a little bit of a broken record, but I take this. I look at this with sort of an optimistic nod to the future of public transit, and here's why: because it's easy to look at it right now. You see the decrease in revenue, you see that decrease in ridership. You think about the concerns that people have about moving forward, about safety and being around other people, and it is easy to be negative about that and just say, well, this doesn't mean anything. But I take a different viewpoint, and I'll point to the essential trips and essential workers that have been a base of our service and the people that we are transporting, but really truly a base of service in the community. Um, we've seen nurses, grocery store workers, like clerks in other stores. That has kept, I mean, quite frankly, that's kept us going. I mean, if we had not been able to have nurses get to work, or, doctors or grocery store workers, what would have happened? So, you know, being deemed essential at first was like, I mean, to be honest with this group, I was like, I hope we can just shut down. Let's just shut down. Everybody will be safe. I don't, people will be safer. But when we got deemed essential, it was like, all right, we're essential. We got to figure out how to do this and we got to make it work. And then all of a sudden it was like, wait, we have our workers are essential and we're getting people to where they need to go. So that sort of bolstered me to think like, no, we really are like, we can't not do this type of service in our community. And so I think that realization of the critical nature of what we do, and by in turn what that means for the community, to me, it has made me feel really optimistic about the future, knowing that. And then I guess maybe my other positive spin on it is I think it's almost like pent up demand, like it's sort of pent up consumer demand, but also just pent up demand to do stuff. Everybody's been that's been able has, sat around, like you joke, I've watched Netflix, like the whole thing. I've seen everything on Netflix. I don't want to watch any more TV. Like when I can go out to dinner or go bowling or whatever, I'm going to want to do that. So I think that in there's going to be pent up demand both for spending, but also just for getting around in our community.
So here's a comment question, sort
Mhm.
of. I would love to see public transit more broadly used across our community, similar to Portland or other larger cities. Is this part of the conversation at TARC?
100%. And I agree so much. I want to see public transit more used in the community for sure. I mean, truthfully, maybe not right now. I mean, right now is not, we're not doing any big marketing pushes. We're not really trying to get more people on board because of limiting service and essential trips. But when everybody's ready to travel, we are ready to have people on board. And I think it's definitely part of the conversation at TARC. I mentioned one of the early slides that we did a comprehensive operations analysis, which looked at our routes, which looked at our schedules, looked at our timing, and we sort of had to put that on hold as we responded to COVID. But we'll be looking to wrap that project up. So kind of stay tuned. Upcoming meetings, or if you want to learn more about that, let me know. We are also going to start a long range plan effort, and that will kind of get at some of these issues about how can we get people who maybe aren't riding, haven't ridden, are used to their car, and get them on board and really be part of that larger response to people using transit as just their base way to get around. And is the other thing that I've kind of pre-COVID that I thought was interesting is how quickly so many people were willing to ride the ride hail services, Uber, Lyft, and all the other sort of new companies that came on the scene. And I remember like talking to my friends, and I'm like, that's paratransit service. Like that's on-demand paratransit service. Maybe not paratransit, but it's on-demand service. That's public transportation. And it was like, no, it's not. And I'm like, yeah, no, that's exactly what it is. And everybody is just like totally willing to get into it for a variety of reasons. And that's a whole other separate conversation on rideshare and why people were willing to sort of do those ride hail app type services. But that is definitely part of the conversation. And I think the more that we can hear from the community about, why they weren't riding or what it would take to ride, is it timing, is it location, is it schedule? I think all those things are important to feed into our kind of our conversation internally, so that we can have a better response to be able to provide better, more service that people really are interested in using.
So, a couple more questions here. How has your workforce been impacted by COVID-19? What
Mhm.
provisions have you made to support your workforce during the pandemic?
Yeah. Well, this is well, it's impacted our workforce for sure. it's been a challenge to kind of keep up. I mean, I don't even want to say morale, but kind of morale. We have people that are able to work from home. If you're doing finance or marketing, you're able to work from home, and we're encouraging people to do it. But we have 200 plus 300 people, if you include our contractors, who are here every day, working on the buses, cleaning the buses, driving the buses, and they've been here every day. So that part, I think, has been a little bit of a challenge. It's also hard. You can't really have that same camaraderie, if you have to stay 6 feet away and you can't. I mean, I even thought about it this week. I'd like to just get lunch for folks. Let's grab a pizza and kind of sit around the break. Can't really do that. So I think that sort of camaraderie and morale has been hard. It's like, I don't even want to say this because I'm going to jinx it, but most of our positive cases, almost to a one, have come from exposure outside of TARC, not workplace exposure. Now, don't quote me on that. I don't have the percentages. I haven't run the numbers. And part of the reason why I'm anxious to say that, to jinx it, is this Thanksgiving, Christmas, New Year's Eve surge, whatever you want to call it, it's going to get worse before it gets better. And but we've seen most of it as my wife had it, or my coworker had it, or my cousin brought it, inadvertently was sick when we had Thanksgiving. So that's where we're seeing those sort of impacts, not from the workplace. So, but it's been an impact. It's been an impact for sure, and not the best one.
So, can you speak to how COVID, the pandemic, has impacted rural transportation, people who depend on it?
Mm-hmm. I don't have as deep a perspective on the rural transportation, but I will mention something that the head of the Kentucky Public Transportation Association mentioned to me on a call the other day. I think one of the most vulnerable situations that I can think of in COVID is if you're a positive, you've tested positive for COVID and you are on dialysis. And our rural transportation providers, or non-emergency medical transportation, and the rural transportation providers have had to transport positive COVID patients to get to dialysis. And to me, that is just the most fragile. It's just a very fragile population, and a real testament to those transportation providers that have kept doing it, and the drivers who are willing to take that passenger on board. I mean, that's where you have face shields and the mask and disposable gloves and gowns to keep the driver safe. But that, when she said that, she's like, yeah, positive dialysis patients, what are you going to do? You have to take them to dialysis.
Yeah.
So I know they've been hit hard as well, but they're just trying to get through it.
And one last question here, I believe. Yes, I've heard stories of individuals, particularly vulnerable populations in other cities, experiencing hardships because transportation has been decreased. Is TARC capturing similar stories in Louisville to illustrate the importance of public transportation?
Well, that's a great point, and I don't know that I have any sort of particular stories to share, but I think that is I really appreciate that, and I think it's true. I mean, I think the dialysis, positive COVID and dialysis, and I think other folks that we might not even know about. That's important, and we need to capture those stories because it does help share that the importance and relevance of public transportation. So appreciate that point very much.
Great. Thank you so much,
Thank
Carrie.
you.
We really appreciate it. Please stay on. We're going to introduce to everyone, most everybody I think know her, Dr. Christian Furman of the Traeger Institute Optimal Aging Clinic. And she's going to give us a COVID update from a totally different perspective than transportation.
Yes.
All related, all integrated. et cetera. But she's going to give us a COVID update from the medical perspective, and we're excited to hear.
Yes, Happy New Year, everybody. I'm sorry I'm late getting on. I was doing an interview on Wave 3 that's going to air tonight, so hopefully it's good. But the big issue that's going on now is that we are experiencing a surge, which is true in Kentucky, just like it is across the country. Los Angeles has now implemented their crisis standard of care, which basically means rationing healthcare. There's not enough to go around. So we have not had that happen in Kentucky, which is amazing. So thank God we all live in Kentucky is all I got to say. But I was on hospital service last week, and usually I've had 1 or 2 COVID patients. I had 6 COVID patients. So it's, it's tripled, it's out there. Everybody needs, the governor announced more cases than we've ever had before. So everybody needs to wear their mask. If you can wear eye protection, that gives you about 0% chance of exposure. Stay 6 feet apart, still do everything. Get your vaccine. The big thing now is that we have the vaccines, and the health department is giving out, U of L Health, each health system is giving it out. So U of L's already given it to all its first people, the people that are actually taking care of COVID patients. And now they're going to the hospital people, and then the next will be the clinics. But the health department's also giving it out. There's going to be a big vaccination downtown that one of Molly Dobson that works with us, and Angela Linenback and Beverly Williams Coleman, our nurse practitioners, are going to be giving the vaccines. It's in February. It's when it's scheduled at the convention center, or I forgot exactly where downtown. But the good news is there's a vaccine. Everybody get the vaccine. I mean, it hurts. It hurt when it went in my arm, but it was gone in 2 days. I had no fever, no symptoms, no nothing. They do monitor you, so it's safe. The other big news is today, my nursing home, Presbyterian Home, is being vaccinated. And so CVS and Walgreens is who the federal government contracted with, and they are vaccinating all the nursing homes. And that is happening already in December, but even more so in January. So all the staff and all the residents are being vaccinated today, and that's starting to roll out more. And the other good news is there's a new treatment for outpatient people, for outpatient treatment of COVID. It's a monoclonal antibody. And I'm pretty sure this is what President Trump got when he was in the hospital, but we're really not giving it to the hospitalized patients. It's really been studied for outpatients to try to prevent hospitalizations. It's called Bamlanivimab, which is BAM, they call it BAM for short. It's an infusion, and they do it at U of L Health is giving it out at our infusion centers, which is Medical Center East, Marian Elizabeth Hospital, and Shelbyville Hospital. And I'm sure all the health centers are doing it, but it's only for people that are COVID positive with symptoms that don't require hospitalization, and they have to have high risk. So they have to be overweight, chronic kidney disease, diabetes, if you have an immunosuppressive illness or on immunosuppressive treatment, if you're over the age of 65. So, I'm a geriatrician, so all my patients are qualified just based on their age. Or if you're 55 and over and have cardiovascular disease or hypertension or lung disease, you can get it. And it's for ages 12 and over. So the younger people, they still have to have, BMI, overweight, or sickle cell disease or congenital heart disease. So there's all kinds of new and good stuff going on. I know the other big thing is this new strain that's come out that, they found in, I think, about 4 states now. I think California, I can't remember the states, New York, I think Colorado. And pretty much those people that they found the strain in had not traveled. So I bet it's really everywhere, but we just haven't really, those people everybody's getting tested. But viruses do mutate, that's to be expected. So it's just a natural occurrence. They really think the vaccine is still going to protect against this new virus. I mean, they didn't study this new virus, they don't know for sure, but if you do all other vaccines and all other viruses, these vaccines do work against the mutated viruses. They say the big issue with this new strain is that it is more contagious. It can transfer easily. So that's why you need to wear your mask, wear your eye protection, stay 6 feet apart, and don't be going out and partying with a million people. And yeah, I think, we should just, even with the vaccine, everybody needs to keep wearing, even if you get the vaccine, you keep wearing your mask, you keep doing everything that you were doing.
So
What other
here's another question. What percentage of staff and residents at the nursing home are consenting to receive the vaccine?
Oh, every nursing home is different with a different culture. I will say at my nursing home, I was horrified because some of the staff said they're not going to get it because the vaccine affects your DNA. And I was like, what are you talking about? It does not affect your DNA. It's messenger RNA, and I think people get confused. It's different. It does not affect your DNA. And vaccine. And people are also concerned because they say it hasn't been, I mean, it was pushed through it so fast, it's not been studied. There's a pandemic going on. So because of a pandemic, everybody has stopped across the world, has stopped their normal research, and everybody was working on a vaccine. So that's why it got done so quickly. And thank God it did get done so quickly. So if everybody was working on everybody in the world was working on breast cancer research, we would have a lot more. So if everybody in the world was working on Alzheimer's research, we'd have something. So that's why it was so fast, is because a lot of money was put into it. Every scientist across the world was working on it. So it's safe. It's not been pushed through and skipped steps. All the steps have been taken. So at our nursing home, it depends, some people, I don't know, we'll see who gets vaccinated, right? But I tell you, all the families want all the residents vaccinated. I think that the pushback we've been getting is with a lot of the certified nursing assistants that just are getting their information from social media. So if you can really tell all your friends and family, it's been studied, it's safe, please get your vaccine.
So this one says, I know someone and have heard of others who have had the vaccine and a day or two later tested positive for COVID. I know this is probably a chicken and egg situation, but can you provide an explanation?
Yes, I've heard of that too. Is it causation or association, right? Positive. They've studied that 100%. The vaccine does not cause you to test positive. So what happens is when you get the vaccine, you're not immediately immunized, right? It takes your body a while to kind of work it through. So I have to remember, but I think it was like 11 days to 20 days when you're fully vaccinated, you're fully immunized, your body is, and then really you have to get that in 3 weeks, you got to get another shot to get even more immunization. It depends on the vaccine. Some people, I think the Pfizer vaccine, like the first shot gives you 85% effective. And after the second shot, you're like 95% effective. And I think the other shot, I'm blanking on the other one, but it was started off the first shot, like you're 91% effective. And then after the second shot, it's 95% effective. So, even though you get the shot, you can still get COVID. Especially in that first 21 days. And even after the second shot, I mean, it's 95% protective, both shots, but it's not 100%, so you can test positive for COVID and actually have COVID. But the big thing that this vaccine does, if you do get COVID, it's a milder case. You're not going to end up in the hospital on a ventilator and die from COVID, with the vaccine. So that's a good question because that is starting to happen. I've heard that too.
Yeah. Actually, someone that I know personally had that experience. So I was curious to hear your perspective on that. Any other questions for Dr. Furman? We've got a couple of minutes before 11. You can unmute and ask if you have a question.
And I will say the testing at the nursing homes, we were getting tested twice a week and we still are, but the funding has changed because the state and the federal government only provided so much funds, and now it's becoming an issue of who's going to be funding it. So it's working out, but it's an issue. And maybe with the new money that's come from the House and Senate and Congress passed new money, maybe that money will help pay for everybody to get their testing like they were getting tested at the nursing home.
Here's a question. Are there any concerns about getting dose 1 and being unable to get dose 2 dose 2 weeks later.
Yeah, right. They're 3 weeks apart. So they really tell you when you get your first one, like, are you going to be able to be here in 3 weeks and get your second one? Because they really want to schedule it where you can get both. So, that's where the research was done, right? 3 weeks apart. But if you're 3 weeks in one day or 2 days on either side of it, I mean, you should still get the second shot. So, yeah, hopefully no one's unable to get that second shot, wherever you are, please get the second shot. But there is some stuff going on nationally. There was some discussion about, hey, listen, if it's 91% effective and 85% effective after the first shot, maybe everybody should get the first shot. And then after everybody's vaccinated with the first shot, then go do the second shot. But the FDA and the CDC and everybody has just ruled on that. And they said, no, listen, the research was done this way. You don't want to, what if you really need to have 2 shots to make it even work? They don't want it like the first shot to not work if you don't get the second shot. So everybody needs to get 2 shots.
Right. And then
availability, not compliance.
Yes.
Well, the way they're, who knows, but the way they're designing this is the availability is there, because they plan for that availability. But that's kind of an ethical question too that's going on, is like,
right,
maybe ethically everybody should get vaccinated in 1 shot before you kind of save it for and so that has been discussed nationally at the FDA and the CDC, and they really did kind of put out a ruling just this week saying, no, listen, we know what you're talking about, but everybody needs to get 2 shots because that's how it was studied. We're not sure it's like going to work, I guess, as long or whatever if you don't get the 2 shots. So that's a really good question, Colby. Who knows? With COVID, what I figured out is things change. So that's what we're saying today, but it might actually not be what we're saying tomorrow.
Yeah, that's so true. Thank you so much, Dr. Furman, and thanks for jumping on. I know you had a couple other things going on this morning, but we appreciate the update. It's always good. It's always informative. We appreciate Carrie. She had to jump off already. It's a little after 11, and definitely appreciate each of you for joining this morning. Our next COVID session will be in 2 weeks. And Claire, you may be able to tell me what the topic is. I can't remember.
That's because we do not have a confirmed topic yet, but it is planned for 2 weeks from today, which is the 19th, I believe.
Yes, I believe so.
So stay tuned
hopefully
to the website for information on what the topic's going to be.
Great. And anyone who's ever joined generally gets an email with information and updates. So I'll be looking for that, and we'll be looking forward to seeing you all in 2 weeks.
Have a good day.
Thank you. Bye.